Hi, everyone. Welcome to the Kara's Care Show, where we explore the cutting edge of wellness for our mind, body, and spirit. Certain illnesses are always a mystery to modern medicine, and they can really frustrate doctors, almost like a jigsaw puzzle with missing parts that can't be solved. Two of those illnesses have really seen an uptick this year. We're talking about Lyme disease and long COVID. Yes, there's some actual reasons why those two can be related as far as how we treat them. And I'm happy to be joined now by holistic nutritionist Danielle Pashko, who knows this not only because she consults with patients and has been in the industry now for a couple of decades, helping those who struggle with Lyme disease and long COVID, but she has also successfully managed both illnesses on her own. So you know it from both sides of the bed. Thank you so much for being with us, Danielle.
Thank you for having me.
Yeah, let's just talk about first, both of these illnesses together are so frustrating because they can be super difficult to diagnose. In fact, you may not even hear that you have them in your doctor's office, right?
That happens all the time. People can complain of a myriad of symptoms and they go to their traditional doctor, and if you get your lab testing, they're not doing specific testing for any of these two syndromes. So your lab tests may look completely normal, and your doctor may just tell you that you're undergoing some stress and to take it easy, and you get sent home. And a lot of times you go undiagnosed for a significantly long period of time. I've spoken to people who didn't know they had Lyme disease for 25 years.
And that's when I just learned this with my son, and I was sharing this with our viewers, that because of doing stories like this, I pushed to get him tested, but it actually didn't even come back that it was a really strong Lyme case. Luckily the doctor treated him anyway. There were other things, but you may not always get a bullseye. And if you don't treat Lyme disease, that's really when we see all these complications where it can look like arthritis or a whole bunch of other things later, right?
Absolutely. You do not have to have a bullseye. I did not have a bullseye. I already worked in a functional medicine practice that treated Lyme disease, and it was undiagnosed for myself because I didn't see the bullseye rash. So actually, a large percentage of people do not get that. Additionally, some of the testing is not very sensitive. So you can get a blood test for Lyme disease and have some bands, but not be officially within the criteria of the CDC for having Lyme disease, but you actually still do have it and are symptomatic.
Yeah, and that's actually, we were fortunate with my own son that he had such a strong reaction with a high fever and aches and pains, and it wasn't flu and it wasn't COVID. So when we sort of pushed for the Lyme test, and thankfully that pushing, my pediatrician said he might have thought about it down the road, but it probably happened sooner. He later then did break out in a rash, but it didn't look like a bullseye at all. Like they thought it could have been a fever rash.
That definitely can happen, but you're so lucky that you had that background to know to push a little bit further and ask for this. So yeah, that's very important. And I think it's important to educate people so they know to look out for that and do this type of testing just to rule that out so it doesn't disrupt them later on in life.
Right, because there's all these folks like you who are dealing with the chronic effects of Lyme disease going untreated. And if we get it treated right away, which is usually antibiotics, I watched my son bounce back so quickly. Thank goodness they worked for him. Talk a little bit about, though, how do we know? How can we prevent this? How can we make sure that people are getting the treatment that they need for Lyme disease?
Well, in terms of just protecting yourself regarding Lyme, if you're in a place that's a little bit woodsy, like in an area where there's a lot of deer or there's, woods, or even if you're near like a lot of lakes and things like that, ticks like to hang out, especially in the warmer climate. So maybe cover yourself up and wear some tick spray, but you can still get it. And at that point, it's just really important to get tested if you start having symptoms that seem bizarre and you're not feeling like yourself, whether or not you have the bullseye rash. So at that point, go to some kind of doctor, and if they are not finding it for you, and I would probably seek out what's called a Lyme literate doctor who is familiar with giving you the right type of testing to diagnose this. And then there are things that you can do if you are diagnosed with it besides antibiotics, to help to minimize the damage in terms of symptoms.
So what are some of the symptoms that should be warning signs? And again, it's not always a bullseye rash.
Believe it or not, there's like 200 symptoms that can be associated with Lyme disease. So it can go anywhere from aches and pains to brain fog to fatigue to blurry vision, light sensitivity, just, complete and utter exhaustion like chronic fatigue syndrome. I mean, there's so many things that it is just it's called the great mimicker because it mimics so many diseases that Lyme
Yeah.
can even be confused as MS. So it's really hard to know. So if you're having this going on, look for a doctor who is more literate in more in illnesses that are a little bit off the typical pathologies that we see in a normal practice.
Sometimes that might be a functional doctor. I'll say if you're listening in Connecticut, I know Whole Health Wellness in Farmington or the Artemis Wellness Center in Milford. But you could also look, is there a registry or how do we find a Lyme literate doctor if we just want to make sure that we're doing this right?
Well, there's some places like the Global Lyme Alliance, which is a good resource. And then it also just looking up Lyme literate doctor. If you just Google that, you'll probably find some people in your area, especially in Connecticut. I mean, Lyme, Connecticut, right? That's where Lyme, the name originates from. So you can definitely find someone just by looking that up.
And I shared an article on my Facebook page about this being the worst tick season because of all this warm weather. But are you seeing an uptick in patients experiencing these hard to diagnose illnesses?
I feel like I am relating to the warm weather, but also once you have it yourself and you become so aware, I think you notice everyone around you that seems to have something similar to what you've been through. So I think it's a combination of both, but definitely the warm weather is related.
So I'm thinking, especially for all the moms out there, our kids are outside all the time. I know my doctor said her daughter got it on the playground in West Hartford. You don't have to be in the woods. What do you want parents to know so that we can help our kids?
So they can check their children when they get home. Also, if they have animals or things like that, make sure dogs can carry Lyme disease, and really just to maybe spray them if they're going to be outside, especially like even going away to camp. Have spray with them, have them apply it every day. There's no perfect way to avoid this, but just to be as vigilant as you can.
And then if they come home, I mean, for us, I didn't notice. My son really didn't think he ever got bit by a tick, which we don't usually know, but there was no bullseye. We didn't know he got bit, but he tested negative for flu and COVID and was really, really sick. So that's why I pushed for it.
Right.
Other than mother's instinct and hopefully spreading the word like this, what should parents look for, you think?
So if they're just if they're seeing extreme exhaustion and really seeing that their children are just like, this is not my child. I don't know why they're so tired. I don't know what's going on with them. They don't have the flu. They don't have COVID. Then they should really go out and get a test. If they can do that, talk to their doctor. If their doctor's not willing to do it, maybe speak to someone who will. But you have to make sure that you do some kind of diagnostic testing.
And it has to be a blood test, right?
Yes.
Yeah. So that was a little tricky part, getting my 14-year-old to want to get blood, which is
blood test, but
yeah, but it's worth it to find out. And in our case, they started treating it before because a rash popped, and my doctor said it could be a fever rash, but then by the time I brought him in, it had changed. And he said, oh, though, that's typical of Lyme. I said, it is? It's not a bullseye. There were these little marks all over him. And he said, yeah, that can also be Lyme. So a lot of us just don't know, right?
It is so true. Most people do not know, unfortunately. And even someone like myself, who has been working in functional medicine for the past 20 years in different practices, I would go spend my summers in the Hamptons and I'd forget to put on tick spray. And I was guilty of that. I'm like, oh, it's not a big deal. You don't worry about it until it happens to you or your child or someone that you love.
Yeah.
So if you can just have that understanding and awareness, I think it's really helpful.
Well, and on the plus side, I always thought anyone who had Lyme disease, I just knew about all these people I've interviewed who've been sick for a really long time and they're living with it. And then when this happened, I actually met a bunch of people, which I guess is the bulk of people, that if they get it treated right away, they do quite fine. I met people who said, oh, I've had it 2 or 3 times, but luckily I knew to get treated. And so it's not a complete sentence of illness for the rest of your life.
No,
if you find out.
It's not a sentence either way, actually.
Okay.
So you are in the better percentage of people if you can get a test immediately, you get it diagnosed, you go in your antibiotics and you're fine. But there are people like myself who had Lyme disease undiagnosed for a year. Some people have it undiagnosed for a lot longer. And there are things that you can do to mitigate the effects of life and live a totally functional, healthy life and still be well. It doesn't ever completely go away once you're at a point where it's chronic, but you can keep it under control, just like you have something in remission, you know?
Yes.
So that's what I was able to do and manage. And I can share some things with you if you like
Yes,
to help some
absolutely.
people who are really suffering.
Yes.
Um,
I want to let you
you
know our
know,
director just got in my ear and said he's had it twice. But I
oh
know,
my gosh.
so, and I know in Connecticut we have a lot of folks who have had it, but I want
Yeah.
to shift the conversation actually to be great to get treatment. And even though you are a holistic nutritionist, at least I know a lot of holistic doctors who will still recommend getting the doxycycline or something like that. But in addition, you have,
Right. I still always recommend antibiotics. As
yep,
holistic as I am, it's a bacterial infection. You need to do antibiotics.
okay,
Once you're at that point after you've gone through that, it doesn't completely eradicate it once it's chronic. So doing antibiotics a year, 2 years, 3 years in is not going to completely eradicate it. You have to start looking at your lifestyle at that point and making changes because this is your life.
yeah.
And Lyme disease is a disease of dealing with a lot of inflammation, right? So the body, when you're having those inflammatory symptoms like migraines and joint pains and headaches and things like that, it's the inflammation. So we need to bring that down. And that first comes down to diet. So working on eating an anti-inflammatory diet. So if you've never been really that conscious about whether your foods are organic or not, that's really important. So having organic fruits and vegetables. If you're going to have red meat, make sure that it is grass-fed. If you're going to have fish, make sure that it's wild. You know, just being really conscious, having good fats, which also help bring down inflammation. And also another thing that has really helped, I know people always know for keeping your immune system up is definitely important, but it's not just about taking vitamin C and zinc and vitamin D. I have been so into mushrooms, and there is a supplement called AHCC, which works really well for helping the immune system, also bringing down that inflammation, and it helps to lower the viral load. And which is interesting between Lyme disease and viral load is you can have old viruses from childhood, like Epstein-Barr, herpes viruses, cytomegalovirus, that can reignite once you have Lyme disease. So it's antiviral, and it also helps manage glucose levels, and your blood sugar can be very dysregulated when you have Lyme disease. So also using this mushroom extract, AHCC, has helped me a lot in my immunity, inflammation, viral load, all of that.
So
I have
where
some more things I can share. I just don't know how much time we have.
Yeah, no, we're going to keep, we have a while. But tell me a little bit about, with the mushrooms, the AHCC supplements, where do you
Yes.
get them? I know quality matters. And how do you take them?
There's a few companies that make them. There's one called Quality of Life. And I think it's one of the most reputable forms of AHCC. You take them as a supplement. Eating mushrooms is not the same. I just want to be clear. It comes from shiitake mushrooms. One thing that people with Lyme disease or any chronic illness, as a matter of fact, want to avoid eating or being in moldy environments and
Okay.
ingesting foods that carry too much mold. So you don't want to overdo it with eating the mushrooms, but you don't have that issue when you're ingesting them orally as a supplement. That's why you'd rather take supplemental mushrooms rather than eating them,
Okay.
if that makes sense.
Yeah. Okay.
Yeah.
So on this show, we talk a lot about different practices. And fortunately, in Connecticut, we have very good functional and naturopathic doctors around. But if you're not
Great.
aligned with some of those, I mean, is this something you could get at Whole Foods? Should you Google something? You said quality of life. Just Google quality of life AHCC.
Quality of Life is one of the companies that manufactures it. That is the one that I'm familiar with. I know there's some others as well.
Okay. But that's what you
Health
take.
food stores may carry it. Yes, yes, I take it every day. Even if it's not for the Lyme, just because so much COVID's going around.
Yes.
I feel like it's everywhere right now. And we're
Yes.
going through another surge, and I really just want to keep my immune system up. So I'm very consistent with just using mushroom therapy just because I want to make sure that I stay well and healthy.
Yeah, and something else we've talked about for at the first sign of sickness, but my naturopathic doctor also recommended it for my son, was a high-grade oregano oil, which is also antiviral and antibacterial.
Very good.
So people don't think of
Very
this,
good.
but I guess mushrooms, oregano oil, in addition, even after the antibiotics were
Right.
done, like keep taking it. And
Absolutely. And oregano is so good for the gut as well.
okay,
If you think about that too, a lot of the bacteria that happens in the gut, you really want to have a healthy gut microbiome because 70 to 80% of your immune system lives in your gut. So like you said, the oregano oil is terrific. A really good quality probiotic because you want to replenish that good bacteria, especially if you've been on antibiotics for months. I was on antibiotics 2 different times for 6 months at a time. So think about all of that, what it did to my gut microbiome. So
yes.
making sure you stay with the probiotics for sure.
Yes, yes, and a good quality probiotic. And this would be for kids too, right? And a lot of people say, "Oh, I'm nervous to give my kids so many things," but a
Yeah.
probiotic, it's kind of hard to make them maybe eat as much yogurt or sauerkraut. So this would be a way to make sure that my teenage boy is gonna still want to eat his Chick-fil-A sometimes. So the probiotic is
Yeah,
really
yeah.
helpful,
You know,
right?
there's chewable probiotics. They make it a lot easier for kids and probiotic powders.
Okay.
There's a lot of ways to sneak things in for kids. You can also take capsules, and I used to be a nutritionist for a kids' school. And what I would recommend a lot for parents is you can make even smoothies for them and put a lot of fruit in them so they taste really good. And then you just open up a capsule with the probiotic in it and just pour it into their smoothie
Okay.
so they can have something that tastes good. They won't even taste it. So they're not taking pills because kids
Yeah.
don't like to take pills.
Yeah, right, right, right. Sometimes you just got to get it in there. So let's talk about the link between Lyme disease and long COVID. Not that one causes the other, but the symptoms can be very similar and confusing.
The symptoms are very similar because I was talking about before how they're related to inflammation. And actually, they are related in a way. A
Okay.
lot of people who have Lyme disease already have dysregulated immune systems. So if they get COVID, they may have a mild case, but they're more susceptible to getting long COVID. And that just has to do with their immune dysregulation. So the symptoms, again, between Lyme and long COVID, you could have like 200 symptoms that are just very confusing and you don't know what's happening. And again, it's this utter fatigue, even chronic fatigue syndrome kind of goes into this mix of what these both feel like. So feeling a lot of exhaustion, feeling a lot of the brain fog, the migraines, the joint pain, the dizziness, all the inflammatory things. Because when you go through COVID, people deal with a lot of sometimes almost like a cytokine storm, which is
Yeah.
full of inflammation. And they start having all these problems and pains and fatigue. So unfortunately, it's so hard to know the difference between Lyme and long COVID that unless you do some testing, you may not know which one you have. Or you may, like you were smart enough to check, but someone may not be feeling good and you may say, oh, my child has long COVID or I have long COVID. And you may have just happened to have been somewhere that you got bit by a tick around the time, maybe a month after you had COVID, and you think it's the COVID, but you really got Lyme. And they're
Okay.
so similar, you don't know which one you have.
I know we can do a blood test for Lyme, and I know the other recommendation that I've done on other shows here is while you're at it, just ask for a full tick-borne panel because it may not be Lyme, it could be another tick-borne illness. So make sure you test for all of them. Ask for that full tick-borne panel. But is there a test for long COVID? How do we know if we have that?
So there's no test for long COVID. And what we try to do is do blood work that's kind of specific on checking on what may be a little bit uh, different than what you've noticed before. So doing a viral panel is very important to see if some of these same thing, like I said, Lyme can reactivate old viruses. COVID can do the same thing. So you can have a reactivation of the Epstein-Barr virus, which is the virus that causes mono. So maybe you had mono in college, you're fine, you got over it. Suddenly you take this test and now you have Epstein-Barr. Epstein-Barr causes fatigue. So that can be related to your long COVID symptoms. You could have had, there's different strands of herpes, not necessarily getting a cold sore or an STD, but there's a herpes 6, there's shingles, there's things like that. That can start coming out. So that would show up in a viral panel. Also looking at the cytomegalovirus, which is another virus that is something that might show up when you have long COVID. Also, if you start having some symptoms neurologically, you may want to see a neurologist because You can also, from long COVID, we're finding a lot of neuropathy, which is like a full body pain
Mm,
or tingling or numbness,
mm,
and that can show up. And from that happening, that's closely related to some other syndromes. One, for example, is POTS syndrome, which is postural orthostatic tachycardia syndrome, which is a dysregulation of the of when you're standing up from sitting, your blood pressure drops and your heart rate goes up and you get very dizzy. So you're having
mm.
these dizzying syndromes. And if that starts to come on after COVID, you probably have some kind of long COVID. So seeing a neurologist is the next step if you are having any kind of really persistent symptoms.
Okay. Okay. Um,
Um,
so let's go over some of the lifestyle changes. If we can give people at least three things to do. Number one, an anti-inflammatory diet. So you want to Google that. You mentioned organic foods, but what else should we
yes.
eat more of, and what should we really avoid?
So, the lots of fruits and vegetables, avoiding, I mean, sugar we know is not good for us in processed foods, and um, y- alcohol, coffee too, sorry to say it, but when you are dealing with all of this, you really want to keep your nervous system kind of level. So trying to avoid coffee
Mm.
and just eating as healthy as possible and just being more mindful of what you're eating, because at this point, it does really make a difference.
And what about exercise? I know you are big into yoga. Some people might want to do that. Is there a benefit to
So
reducing
I
inflammation?
am. I'm very big into that, but there are these people who are suffering, and for them, they get what's called post-exertional malaise,
Okay.
meaning that they exercise too hard and they just get really exhausted, and then they're like laid out on the couch for a day or two. So exercise is important. It's good to move. But at the same time, if you're having these symptoms, don't overdo it. Don't look to go to berries or any of these like kind of spin classes or, anything that's too exerting. They're
Okay.
wonderful. And I'm a fan. You're well, but, slow, gentle walking, stretching, yoga, Tai Chi,
Weights?
breathing, like really go easy. Treat yourself in a very nurturing way so you don't overexert and you can just move the energy, but you're not hurting yourself.
Well, I know, like, what about weights? I know, especially with, I'm thinking, my young son and then men, they like to do their weights. And especially if you have children or teens, they might be athletes. And there may not, there's a
Right.
concussion protocol, but I don't know that there's a Lyme protocol. So is there, as
It,
parents,
it goes it goes from person to person. The whole time that I had Lyme, I really didn't have any problem working out. I didn't go back to I used to be a very much more extreme kind of athlete
okay,
prior to Lyme. So I didn't go back to the very extreme workout, but I still maintain my yoga every day
okay.
and my weights. I was fine. Some people are really debilitated and they're not going to be able to do that. So I would say it goes case by case. Experiment, start off light. So if you're used to lifting heavy weights, lift gentle weights and do less repetitions and see how you feel.
Okay.
If you're managing just fine and you have energy, keep going. It just totally depends on each person.
So how strict do you have to be, both in following the diet, doing the gentle movement, taking the supplements? How strict do you need to be, and how long will it take to feel better?
So I think in the beginning, you really do need to be strict and that you want to heal as much as you can. So, we're not saying never to live again and not to have fun, but I think it's important to stick to your rituals at least 80% of the time. Do what you can at home. Things are going to come up. It's holiday season. You don't want to feel left out of everything. There are going to be moments when you're going to fall off maybe a little bit. But I think it really is important, especially while you're healing. It's almost like if you're doing a diet, like the first month or so, you want to go in really keeping it. And then afterwards, you're doing more of a maintenance. I think when you're first starting to feel the onset of any of these things, really keep strict to it. And then once you kind of get the hang of it and your body starts getting stronger, which we hope it will, then you can start pulling back and going more into a maintenance zone. And you said how was the second question, how long will
How
this
long? I
take? Was
know
that
that's an individual thing, but people want to have hope, I guess.
Well, I want to give them some hope. I mean, I was able to pull through it, and I see people who don't. And how long, besides doing these physical things, a lot of your mental state is so important. And
Mm.
I've been so interested in the whole idea of, psychoneuroimmunology, gee, sorry, big word, but it has to do with the idea of the way we manage our thoughts and how it affects our immune system. And that's really important. So I think meditating is really important, visualization. If you are interested in some kind of prayer, you don't have to do that, but just getting into a place where talking to yourself, getting into a belief system that you feel that you're going to get better, and really working on that. That's really important. If you are in a constant state where you're just on chat groups all day and being reaffirmed by other people who are ill and who are keeping you in that constant chronic state, that's going to worsen you. So try to surround yourself with good people who are motivating you to get better. And I think that's going to speed along your process.
What single lifestyle change has helped you the most, do you think?
I think, honestly, probably I've always eaten well and healthy and all of that, but I think changing my mindset, and I think really having a very strong belief system, just like we said, I think it's very important. And on top of that, I have to mention, make sure you get enough sleep. That is very important.
Sleep
to manage
is
that,
very
because if
important.
you don't sleep, you're not going to recover.
Yeah, and that can be a big deal for some folks, but especially you probably need extra sleep when you're recovering.
You need extra sleep. Sleep is when you do all your recovery. So definitely try to get your nervous system under control by relaxing more and getting your sleep.
So as people are ending this broadcast, we have about 2 minutes left. How do you bring up these concerns with your doctor?
I think you should go in and explain everything that's going on, but make sure you're very calm about it, because unfortunately, there is a lot of gaslighting from certain doctors when they just do not have an understanding of some of these hard to diagnose illnesses. And you don't want to come off as someone that's, just anxious, and it's more psychosomatic rather than actually being something that's physiological. So come in calmly, explain everything, and ask them to do the correct testing, because you have a keen sense that something is off, and you really would like them to to be able to help you and find a diagnosis.
Yeah, a good advice. And you can even say, hey, I was listening to the Kara's Cures podcast, and we have another one with Dr. Artemis Morris. You can go back. She was a doctor who actually was misdiagnosed herself, but thankfully she's a holistic doctor, so she went on a journey to heal. It wasn't Lyme, it was another tick-borne illness. So we're just starting to learn about all this. So as we end, shout out where people can follow you or learn more, please.
Well, my full name is Danielle Pashko, so most of my handles are Pashko Wellness. My website's pashkowellness.com, or they can find me on Instagram or Facebook at Pashko Wellness.
PASHKO for those who are listening and not seeing it on the screen right now. So there you have it, the links between Lyme disease and long COVID and how we can heal. Thank you so much for being here, Danielle.
Thank you. It was a pleasure. Happy holidays.
You too. I hope this was helpful and serves you. Have a great day and be well.